In today's episode of the Buzby Dog Podcast, we're going to talk about an issue that clearly does not affect Jake the red hound who's lying here on my lap snoozing away. Today's topic is insomnia in senior dogs, which you might think, do senior dogs have insomnia? And if you're thinking that, stay tuned because I'm going to tell you the full story. So a couple years ago, a gentleman came to me as a new client asking me to acupuncture his geriatric dog who frequently paced and barked at night. And I know acupuncture can be helpful for sleep-wake disturbances and also behavioral problems, but I certainly had never been asked this before. So just sitting there and talking with the man while his dog kind of walked around the exam room was extremely enlightening. I learned stuff that I honestly never really fully understood as a veterinarian. This gentleman described his wife, who was the dog's primary caretaker, as being on the verge of a nervous breakdown. Like many moms, she was a light sleeper, and she was deeply devoted to caring for her dog's needs any way she could. At night, she would awaken when the dog began panting and pacing, which really was almost a nightly occurrence. So she would get up and try to settle the dog down by taking him outside, offering him water, turning on a fan, moving to other rooms in the home, but nothing helped. And this nighttime ritual just had to run its course until the exhausted dog and the exhausted woman finally fell asleep together in the early morning hours, and sometimes even on the floor somewhere. So I've learned over the years that this is not some sort of rare isolated case. Restlessness associated with panting, pacing, and sometimes vocalization at bedtime and even overnight is not really all that uncommon in senior dogs. And obviously, this problem can have a profound negative impact on quality of life for both the dog and the dog's family. Hearing my client's story, I certainly developed a more acute understanding and awareness of dogs who are awake, actually not just awake, they're restless during normal sleeping hours. And there are dozens of reasons why this occurs, and getting to the root cause can seem impossible, especially if there are multiple contributing factors in a senior dog. However, through a careful physical exam and a holistic approach, that's WHOLISTIC, I think restful nights can be a reality. There is hope. So let's start with the ideal beginning of the story, which is making a diagnosis. And I want to give a little parenthetical plug here for the importance of making a diagnosis. Often when clients come to us, what they really want is just to make their dog better. And that makes sense, right? I get that. So they want that treatment plan, they want the action steps, and they want to know what to expect and we call it the prognosis, what's going to happen. But honestly, it is difficult to compose the ideal, if not impossible, to compose that ideal treatment plan and offer an intelligent prognosis, that expected outcome, without first making and understanding the diagnosis. So to reiterate, for best results, ideally, and it's not always possible, but ideally, we need to figure out why this nighttime restlessness is happening. This can be caused by a variety of issues. It can be caused by cognitive disorder, which is a thinking problem, a brain problem, a behavioral problem, some sort of a medical malady, or a combination of those causes. So to make the diagnosis, your veterinarian will start by talking to you about your dog's symptoms. They'll perform a thorough physical exam and then likely run some tests. So those are the three pieces: taking the history, doing the exam, and then running some tests. And I want to just walk you through how this might go at your veterinary visit. So first of all, you've got what I alluded to as taking the history. It's really an interview. Your veterinarian, or first maybe the veterinary technician, possibly both people, will take detailed notes on what's happening with your dog. And you can really help here by being prepared and organized with your information. Start a journal now. And this is if you have a dog that suffers from nighttime restlessness. Certainly I'm talking to you. But if your dog has any sort of a health issue that you're concerned about, it's wise to start a journal now and chronicle what occurs and when. Are there symptoms at other times of the day? Have you identified any triggers? Are there factors that make the situation better or worse? And these observations will be important as you convey your story to your veterinarian, but also later on as you compare progress. You need a baseline status, and the journal will help you keep that story clear and not fuzzy as time goes on, as you compare progress and see how treatment is working. So this is a really important step. Keep in mind, one of my mantras is you are your dog's voice, right? The dog is different from the human patient because when your doctor interviews you, you get to tell him exactly what you want to tell him. Your dog doesn't have that luxury. So by keeping a journal, you will better be able to inform your veterinarian on a more complete spectrum what's going on with your dog. Next, your veterinarian will perform a physical examination, and it's really critical that they do a thorough head-to-tail exam on your dog. And I remember once being criticized by a client for being too thorough. He's like, I'm just here for the ears. But again, because the dog can't talk and because often diseases manifest one way and affect other parts of the body as well, I think it's really important to be thorough. And then finally, they'll likely begin with some lab work, probably just maybe a blood test and maybe a urinalysis as a starting point. We call that the minimum database, just some baseline information, and then pending those results, further tests may be recommended. So why does insomnia occur in senior dogs? And I'm using the term insomnia kind of tongue-in-cheek, but really that's exactly what it looks like. There's several reasons, and the most common reason is called canine cognitive dysfunction syndrome. It's a big, long word that essentially means the dog, canine, cognitive brain, is not functioning properly. And I'm going to tell you exactly what this is like in a minute. So it's often noted by owners just at first as unusual behavioral changes. As I said, cognitive dysfunction refers to abnormal changes in the dog's brain, so in memory and awareness, and it's often perceived by the dog's family as doggy senility. So that's what I would liken this to. Canine cognitive dysfunction syndrome is like a version of doggy Alzheimer's. Dogs suffering from this syndrome may change the way they relate to their people. They may become less responsive. They may seem to forget training that they had previously mastered, such as having accidents in the home, and they may appear confused or disoriented at times, which can manifest as them getting stuck in corners of the home. Their little head will be stuck in a corner and they'll be stuck there. And often they can experience also this change in an established normal sleep-wake pattern with an increase in nocturnal activity. So in humans with Alzheimer's disease, a syndrome called sundowning has been described. You've probably heard of it. This occurs in about 20% of people with dementia, and these individuals become more confused and agitated at night. It seems the same kind of pattern can be exhibited by dogs. So that's the number one reason we see nighttime restlessness in dogs, is that it ties back to this canine cognitive dysfunction syndrome. The number two reason I would say is pain. If there are no signs of cognitive loss, then pain is probably the next most common thing that I see associated with senior dogs exhibiting nighttime distress. So the good news is a careful exam coupled with your input should bring pain to light. And musculoskeletal pain relating to the muscles or the skeleton, such as arthritis, is a common culprit. But another issue can be neurogenic pain, which is pain that's coming from the nerves. And that's sometimes treated differently than pain from the musculoskeletal system. Keep in mind that pain is not obvious in dogs. One of the most concerning things that I've heard owners tell me over the years is, well, my dog's not in any pain because he's not crying. That is not the typical way a dog manifests pain. They are usually stoic. They are not going to lay there and whine and cry and complain like perhaps you or a family member would who's in agony. They're going to keep their mouth shut. They will manifest it in other ways, but it's not going to typically be through vocalization. So keep that in mind. Sometimes the pain isn't even obvious to the veterinarian in doing a complete exam. And in that case, What we occasionally do is a trial on pain medications to see if there's an improvement. And this is a safe, easy way to rule out pain. I love the story that a colleague of mine told me of a new client who was at her wit's end with their senior border collie who would pace incessantly at night. And if you know anything about border collies, you know they are very smart and they are very stoic. They are a breed that really does not show pain. So as a whole. So this vet, my friend, was actually a third opinion exam, and the owner was considering euthanasia. She was at her wit's end. So on the exam, the veterinarian couldn't find any evidence of pain or discomfort, but wisely he prescribed a combination of 2 different pain medications, and believe it or not, the dog was cured to the delight of all involved. So apparently this older dog was suffering from some manifestation of chronic pain which escalated at night, but that was a really happy ending. Other diagnoses that can be made or suspected from lab results. So we talked about the cognitive disorder, we talked about pain. Here are some other things that can cause restlessness in senior dogs, and these would be diagnoses that the lab work would help show. Would include hypothyroidism, it's low thyroid, diabetes, Cushing syndrome, and even something as simple as a urinary tract infection. So certainly this is not an exclusive list, but all of these things could cause restlessness at night. And as I said, hypothyroidism and diabetes, they would flag and be pretty much diagnosed by that minimum database lab work that we ran. Cushing syndrome probably isn't diagnosed in that initial panel of blood tests, but there would be indicators in the results that would lead a veterinarian to pursue further testing. A urinary tract infection can be more difficult to detect. If the urine is really dilute, meaning it's not concentrated, and that's common in senior dogs because they're not concentrating their urine for other medical reasons, then the urinary tract infection is more likely to be missed. And this is because the urine's dilute, so if there's bacteria or cells, white cells or red cells in the urine, they're just diluted out and harder to see. So the gold standard for diagnosing a urinary tract infection is called a urine culture. And this sounds horrible, but I just throw this out there because it's done for a lot of reasons and you should know about it. It's not horrible, it just sounds horrible. We actually take a needle right into the dog's bladder, and it's a 2-second procedure. It's not any big deal at all for the dog, and we extract a sterile urine sample so that we can send it off to the lab to culture for bacteria. And that's a really valuable test in so many diagnoses in veterinary medicine. But here we're looking for the urinary tract infection, and if that would come up, if your vet would say, well, I think we should do a urine culture, you'll understand this is the gold standard for diagnosis of a urinary tract infection, and it really can't be done on a free catch sample that you caught at home or the vet tech caught in the parking lot with the dog urinating. It has to be done on a sample taken right from the bladder. All right, let's move to another category of disease, and that's a sad one. It's intracranial disease. Intracranial means within the cranium, within the head. So this is pathology in the central nervous system, such as a brain tumor or some other type of inflammatory brain disease. And a definitive diagnosis here would require an MRI or a CAT scan. These are typically done at vet schools or referral centers. And I get that not everyone would choose to pursue these advanced diagnostic imaging options. And I understand that completely and respect that. But it's nice to know that these are now mainstream options that we have available for diagnosing disease in our pets. So those are some of the things that can cause restlessness in dogs. Let's talk about what the options are out there to help a dog that would be suffering from doggy insomnia. Okay, so first of all, we said that diagnosis can be tricky, and I won't promise that you'll find the complete answer on your first vet visit for it. But once you do narrow down, at least rule out some things, rule in some things, your veterinarian will likely be able to prescribe medications and or supplements based on your dog's history and results. So what he would choose or she would specifically depend on the diagnosis. But here are some things your vet may recommend. I'm just going to give you a grocery list here. So number 1 is Hill's Prescription Diet BD. B for brain, BD. And although I don't prescribe this brand of dog food myself, I have heard many miracles actually from colleagues related to this specific diet. Another thing that might be recommended is increasing exercise and mental stimulation during daytime. Think of the concept of brain game puzzles for dogs, and they exist commercially now. You can get them at any big box store for pets. Next to the concept of antioxidants, it's good for all of us. Omega-3 fatty acids, I think the panacea of supplements for dogs and people, incidentally. A supplement called SAMI. There's a collar called the Adaptil collar, which contains dog appeasing pheromone, which is a pheromone that we can't smell, but dogs can, that can be relaxing to them. Certainly acupuncture may be appropriate. Melatonin, specific medications for canine cognitive dysfunction syndrome, I abbreviate that CCDS. Pain medications, if that's the cause of the restlessness. Sometimes anxiety medications and even seizure medications. I'm certainly not giving you this list to go out and experiment with. My intent is to give you hope, to realize there are a lot of options to help dogs who suffer from nighttime restlessness, and you and your veterinarian will work together to formulate the best treatment plan for your dog. Which leads me to my next point. If you personally can identify with the exhausted owner in this article, please contact your veterinarian. This is not a sustainable lifestyle, and it can take a toll on your health, your dog's health, and your relationships. I'm sure I'm not telling you anything new. But after you've met with your veterinarian and you've hopefully figured out the diagnosis, or at minimum come up with a plan, it's really important to follow your veterinarian's recommendations carefully, because incorrect drug, supplement combinations or dosages can certainly cause serious harm. I think that goes without saying, but in this era of Dr. Google, I think it's important to still mention it. So there's no magic bullet here. There may be some trial and error, some good days and bad days, but I am optimistic that you and your dog can have restful nights with a little bit of perseverance and proactivity. If you'd like to receive more information about products that I recommend for my senior patients, including one that actually supports healthy brain function, I want you to go ahead and text healthy dog. It's important that that's all one word, no space between the two words. One word, healthy dog, to 44222. I would be delighted to send you my free guide called 8 Life-Changing Senior Dog Necessities. Again, if you'd like to receive your free copy of 8 Life-Changing Senior Dog Necessities, simply text healthy dog to 44222.